May is Mental Health Awareness Month, and we thought it was important to bring awareness to this often misunderstood diagnosis. So in this special episode, we'll be discussing the powerful and thought-provoking film, Words on Bathroom Walls.
And to help us out with this, we've invited my wife, Jenny. She is a licensed counselor, a licensed LPCC and a LPC counselor in both Minnesota, Wisconsin, and Arizona. That's 3, not both. So
that was the smoothest introduction I've ever had.
Thank you. However, we're going to let her weigh in on this movie of how realistic it was, what you can expect maybe in some counseling if you ever decide to go after some yourself. So, watching this, how accurate do you feel like this was portrayed for schizophrenia, for mental health, even counseling?
I thought that this film was really well done. It was a good portrayal. Now, certainly schizophrenia looks different for each individual who's suffering with it, just like other mental health diagnoses look different for each individual. But I feel like they showcased a lot of the different criteria or things that would put you in, that category of diagnosis of having schizophrenia. And there's lots of elements of his treatment that I thought were also really well done.
Like, can you give an example?
I thought it really portrayed a lot of the struggle for families to pursue mental health care, and that there's not a one-size-fits-all option to treat different conditions, that there are patients who struggle with
treatment resistant, which means we're probably not going to have our own "it's not your fault" moment from Good Will Hunting.
Even outside of the realm of serious mental illness like schizophrenia, you have things like depression, where sometimes there are individuals who try a slew of drugs before they find one that works well for them. So just kind of navigating that struggle is really hard.
What I really enjoyed about it is I felt it spoke to more than just schizophrenia. It spoke to really just mental illness as a whole, and what both the patient, and their support system has to go through in dealing with this and trying to address it. And as Adam says in there,
I'm not the illness itself. It's hard not to feel like that when everyone treats you like one.
Yeah, I definitely agree as far as that's one of the aspects that most movies don't tend to follow up on, is they go from just the patient side, the one who suffers, instead of what the whole gambit, I guess to say, of what is going on. And they throw in even that extra layer of a step-parent. Now, being one who really you often bring up, I focus on special effects and everything. This was very well done for it to give the creepiness of maybe the darkness that haunts him, to have the different voices, the different people you see. My question, I guess, with mainly going into about when he's interviewing for the getting into the school and the room starts catching on fire and everything. Now, he doesn't freak out about it. He's just entertained by it.
And how are you
Is that possible?
In that particular scene, Adam has pretty high insight.
All fired up.
Meaning he is able to distinguish between reality and what's a delusion and, a hallucination in his mind, which is part of what lightens the mood. There are other scenes in the movie where he feels truly fearful about some of the scary things that he sees and hears, and they become harder to distinguish from reality. Being entertained by their hallucinations, sure, I don't see why not. I think some of that speaks to the character's personality, keeping in mind they're individuals. He had a great sense of humor, which is showcased through the whole movie, so it makes sense that he would see things that we could look at and think are pretty comical.
Mm-hmm. They did well to balance the humor and the drama moments, so it isn't just this overly dramatic, heavy slog through this movie, and helps to, keep the mood as light as it can. I think the other thing I appreciated is it did touch on so many aspects, that the challenge of, at one point his mom gets pregnant. So the challenge of a life change happening to someone who's already going through all sorts of turmoil in their head, as well as Adam's a high schooler. So,
How hard could it be to hide my burgeoning insanity from the unforgiving ecosystem that is high school?
and I think we talked beforehand that can add, you'd said something about that sometimes that the main diagnosis will overshadow other things that are going on. I forget how you put it. I'll let you actually touch on that.
Yeah, the point you're alluding to is co-occurring disorders. So it's very, very common in mental health that people don't just have one diagnosis they're dealing with. They talk quite a bit about Adam's schizophrenia in the movie, but they don't necessarily address his depression. It makes sense to us as viewers. Anyone who's had sadness, who's gone through hard times, understands how he's feeling in these really painful moments, but we don't necessarily think about the clinical impact on him of just dealing with that level of hopelessness. I have something else I'd like to add about the nun scene.
Yes.
So, spoiler alert, he is sitting in the room talking to the nun while the room is lighting on fire in his hallucination, and the nun's habit is lighting on fire and all of this. It's a great scene. We all loved it for its comedic impact. One of the things this movie does phenomenally, in my opinion, is to help us empathize and really put ourselves in the perspective of what it would be like to walk through life with this mental illness, what it would be like to see these things. I'm curious if you or any of the viewers had trouble concentrating on the dialogue that was happening.
No, I was absolutely totally focused on what was going on, not just because, yes, it was our favorite scene, but yeah, I mean, to your point, I can only empathize being in that moment, and it's like, yeah, I absolutely be paying attention to the fire and not what someone is trying to tell me, no matter how much it's important for the rest of, it's important for the rest of my life.
I mean, yeah, I know at the time I was listening to it, but sitting here playing it back, no, it's a blur. So we see also a scene where Walter Gogin's character, the stepdad, can't remember his actual name in the movie now, he kind of overreacts by wrapping up his knives and everything, since he enjoys cooking, and it ends up being like he kind of wonders if it's a threat. Do you see a lot of family members overreact and go too far, which makes I feel like it'd probably make the patient feel all that much more trapped and more of a prisoner.
Obviously, that was a bit of an overreaction, but it also fits within the stigma attached to people dealing with schizophrenia. There's this widespread stigma, even for those who don't think that they have it, that these people just might be dangerous. Now, to your point about family members overreacting, I see this even in less severe mental illness, such as when you're dealing with depression. I frequently meet with parents of teens who have engaged in self-injury or have talked about having suicidal ideation, and a common gut reaction, because they love their kid, is to go, oh, we have to race to the hospital, not realizing that this is a common symptom. Of course, there are safety factors to weigh out, but it doesn't mean you need to freak out and overreact.
So as a counselor, with his reaction, talking to his counselor about the Make-A-Wish girl,
It got me thinking. When you're a cancer kid, people can't wait to flock to your aid and are so eager to grant any wish you have before you die. But when you have schizophrenia, people can't wait to make you someone else's problem.
how do you feel the world carries that?
I think we've come a long way as far as reducing the stigma around mental health diagnoses. I would say we've made a lot more traction in terms of the more commonly experienced diagnoses like anxiety and depression. We now know that something like 25% of the population at any given time is experiencing one or both of those. We certainly have more ways to go, and I agree with what Adam said in the movie, you know, essentially invisible illnesses, things that deal with the mind. It's hard for people to realize that they still have genetic and other roots that are not a choice. It's not a choice to see things you don't want to see. It's not a choice to be so clinically depressed that it's hard to get out of bed in the morning.
We are doing a better job, and you more as the professional know this, but that for years it was, what's a common phrase we would all say to people when they were saying something? Well, it's all in your head. It's like, well, that can be just as real, and especially for someone with serious mental illness, it's very real, you know, that they have to deal with that. So not just dismissing immediately, you know, once again. Because we've talked about it, it's like, I don't have any formal diagnosis of any mental illness, but that doesn't mean I don't have something that's going on in my head. Yeah, okay, yeah. That doesn't mean I also don't need therapy at some point too. So I guess that's the key, is don't think that just because you feel like you have it all together that you don't still need that help, don't still need to talk those things out.
One thing you don't see in the movie, you never see the psychiatrist's input. If you go to therapy, it looks nothing like the Freudian memes that you've seen.
So, tell me about your week.
You know, nobody, well, maybe a teenager or two has laid down on my couch before, but that's not standard practice.
I think another part that it touches on that I think is good bringing up this discussion is, as soon as you're comfortable, give the people in your life a chance to choose to love you or not, or choose to be around you or not. I mean, that's a big key and a very touching part of.
You didn't let me choose. You didn't give me a chance to stay.
Because to that point about allowing people to, you know, choose whether they want to be in your life and everything, I think, you know, I thought it's a very poignant line.
Am I gonna sit here and tell you that things like love and honesty can cure crazy? No, but they sure can help.
You know, so he's not, you know, I think that's also the good thing about this movie is it's not trying to paint an overly rosy picture. Telling you this isn't easy, and it's not an easy answer. This is all going to be tough. So it's not trying to give you this pie in the sky version of things. You know, it's like that's what I think it does so well, is I think it just touches on so many aspects of this so well. It's just not only is it good for the mental health aspect, it's just a really good movie as well.
I would add to that I think it's really touching watching the relationship that forms between Adam and the priest at the school he attends, where he at a certain point kind of confronts the priest about some of the things you said really felt unhelpful.
Another fortune cookie answer. You have a list that you alternate?
But that relationship continues to build because the priest keeps trying. And so you may not know what to say, and you may say the wrong thing sometimes. But I think we're all human. It's just about continuing to try to show that compassion.
And as the priest says when he comes to visit him, he may have responded differently if he knew what was going on.
I'm sorry I didn't tell you all this before everything happened, but I had no idea what you were up against.
So to let people in on what's happening, you can get better information, get better support from these people who you think are just kind of going through the motions. Which, by the way, Andy Garcia, greatest role in there. I mean, he just portrays it. I love everybody.
Yes, he does a great
I
job.
love everyone's.
Yes.
But just
Spiritual
him,
guidance?
he's so
Not
human.
really. It's about a girl.
Okay.
Well, we've been hanging out
I mean,
for a while.
everybody's, but you get to see someone who's in that type of role portrayed probably more realistic than what you get to see most of the time in movies of what a priest could be like.
I thought what that showed is that Andy Garcia, you know, his character, that he's been doing this long enough at this school that he's learned that dealing with teenagers, you know, especially when you're talking, religion in general with teenagers isn't exactly something they're usually wanting to sit down and have a long discussion about. So he's learned that he has to kind of do a better job of understanding and meeting, these kids where they are. And yeah, I not that I don't disagree with you that Andy Garcia does a great job. It's just the kid who plays Adam, I think he does a phenomenal job. I think the scene where it's the most poignant to me is the scene when he's in, when he's been admitted, and he's restrained in the mental hospital, just like that really shows. But throughout, he just does, I think, just such a good job of being able, of representing it. I mean, I don't know how else to put it, but yeah.
Okay, so another thing to consider when it comes to the stigma that's around mental health. A lot of us might think that we are in the camp that have come a long way and really don't view people as their diagnoses. It's easy to watch this movie and assume that you would approach Adam with all of the compassion that it inspires as a viewer of this movie. I would challenge you to think about how you would feel if you were Maya's parents and she comes home and tells you, I'm dating this boy, he's really nice, he has schizophrenia, he's been kicked out of a few schools, but it wasn't his fault.
And I think one other thing it made a good point about that is that we all have to think about sometimes is those of us who aren't dealing with a mental illness that's treated necessarily with medication is there are many of us that can ask the question, well, why don't they just take their medication? I mean, it's supposed to make them feel better and everything. But in this, it makes a very good point that it takes some of the opportunities that Adam sees in his life away when he's taking the medication.
I can't cook anymore because my taste comes and goes. I can barely
To help everybody understand who doesn't, that it isn't just this cut and dry. It's not like just you've got a headache and take some aspirin or take some Aleve and it goes away. It's not that simple.
One more piece of schizophrenia in particular that I think they did a really good job of showcasing. So people, when you talk schizophrenia, people know usually about the hallucinations. They kind of think like bizarre thinking, which can be a piece of it. Paranoia is often a piece of schizophrenia. And when I say paranoia, people think, oh, the government put chips in my brain and they are monitoring my thoughts. It doesn't have to be that severe, although it certainly can be. But Adam demonstrates a really subtle paranoia towards his stepdad.
Were you watching me?
Throughout much of the film, where he just feels like he's out to get him. So another piece in regards to Adam's family or his support system. I think it's a really beautiful portrayal in this film of the relationship between Adam and his mother, who is just like his number one advocate.
I know that you must be scared.
So first of
And
all,
that it's
advocates make a
lonely
huge
in
difference. If you
your
don't
head.
struggle
And
with
I
mental
wish-
health,
I wish I could be in
you
there
can
with you.
certainly
I wish
be
I could
an
be
amazing support for someone who does. But I thought it was very interesting and realistic how Adam at a certain scene finds out that his mom has been speaking to a psychiatrist. And he feels like that's a bit of a violation of his trust.
Wait, did you talk to my psychiatrist?
And so I thought it brought to light a very important point, which is that while we want to be involved and support people, they also need to have the safe space of counseling that really feels like their space.
So, Jenny, as our resident expert, are there any final thoughts on mental health you want to add or resources you can share for those who are seeking help?
So I would encourage you, if you are struggling with something, certainly reach out. If you've tried therapy before and it didn't work, therapists are human. Therapists are different. Every counselor has a different personality and different counselors are going to be a good fit. So please try again. The best counselors have their own counselors. So going to therapy is truly not a sign of weakness. And you can be a great support for someone who is struggling.
One last question before we wrap up, and this is for everyone. This is for you two, and this is for you. I want to comment in the comments down below if you've seen the movie. Who is your favorite vision out of the 3 visions he saw? Who was your favorite?
Jenny, you're the guest. I'll let you go first.
I bet it's the same as you. It's like the college bro character.
Joaquin. Yes.
Joaquin, that Adam interacts with, that's pretty interesting.
I really do like Joaquin because Joaquin is the funniest. I thought now I didn't get her name, is the flower child, if you will, played by Anna Sophia Robb. I really liked the part she added to it to kind of, soften up Adam and kind of his, more emotional side.
I'd have to go with Joaquin. I just part of it is he reminded me of one of the characters off of Umbrella Academy, which has been fun to watch. But hey, yes, please let us know in the comments down below. Beyond that, we're not giving any ratings on this. Just see this movie. It's phenomenal. That's all we have to say about it. So until next time, thank you for joining us on our trek through the movie galaxy of the YouTube universe.